This is the case where there is a fracture. You can see very well. Now look at very carefully. These are the cases where there is a small comminution, but majority of the part is undisplaced. So CT scan and 3D CT scan both are very important, and it is not only to just get it, but then you have to use your time as a workup or homework type of planning, that you try to understand all the images and try to have a 3D sort of a visualization in your mind that how exactly are the fragments and what can be done. If you look at over here, it is little bit of only a rotation which we require just to keep this in more better reduction. Otherwise, reduction is acceptable, but just we want to be more precise. So after studying this, we just passed a key wire intrafocally just to rotate it, so that now you can see that it is completely reduced. So this is a percutaneous little bit of rotation, and with that, keeping that rotation, we have passed one key wire which is fixing it. So this is an initial fixation. We know that this fracture line is going right up to the intra-articular region, but we have just kept it, and then we are passing this Gujarat guide to see that it goes absolutely where we want, the best of the trajectory in IP and lateral view, and then we just drill it, and then we put the proper size of Ahmedabad bolt proximally, and then we can pass another bolt which is just distal to it but little away from the tip of the fracture. So here we have tried to, this is the pin which was kept but which is going to the intra-articular region, I mean intrafocal. So what we have to discard this pin. This cannot be accepted. So we have to put the pin somewhere over here, the Gujarat guide, and then we have to pass the second screw which is absolutely inside the proximal fragment and working as an interfragmentary screw. So two Ahmedabad bolt having a good compression. Here you can see hardly one or two threads are left out, but here you can see that there are multiple threads which are still left. That means it is a proper size where you could get a good good compression at that side, right? So this is how